trochanter. So first you start off by putting your thumb around the area of where the femur is, if you had a femur, and then you flex your patient's knee, and then you internally and externally rotate the leg to try and find the greater trochanter, and then you'll feel it. And the trochanter bursa is actually just right on top of the greater trochanter, and whenever the bursa is inflamed, it'll feel like a squishy. So if it's not inflamed, it's kind of hard to palpate for. And then, okay, so now we're gonna palpate the piriformis, and for the piriformis, you have your patient's knee in flexion, and then it's like if you were doing a piriformis release. So then if you internally and externally rotate, it should be approximately like closer to the lateral side of the glute. Okay, so for the SI joint, sacroiliac joint, you first start off by finding your PSIS, and then you go towards the sacrum. You go inferiorly and then medially towards the sacrum, and then the SI joint should be in that location. And then you grab your patient's ankle, and you, whenever you internally and externally rotate their leg, you should feel a space open up and close up. So if you put them like this, it'll open up, and this way you can feel the joint close up a little bit.
Okay, let me do it one more time, just so I can make sure. So to palpate the median sacral crest, you're first going to find your PSIS, and then you're going to move medially, and then once you move medially, you're going to move inferiorly down to about right above the coccyx, and then when you palpate, make sure that you explain to your patient where you're going to be palpating, just so they kind of have an idea. So you're going to place your hand right in the middle. Okay, I'm going to start over. So now we're going to palpate the hamstring muscle group. You have 3 hamstring muscles. You have your biceps femoris, your semitendinosus, and your semimembranosus. You're going to find those by coming in between the ischial tuberosity and the back of the knee, so just right in the middle. And you're going to have your patient flex their knee with adding resistance so that we feel that muscle group. So go ahead and flex your knee. And as she's flexing, I can feel those muscles pop up. Okay, back in. And then, so next we're going to palpate the glute max. So you're going to find the sacrum, the PSIS, and then the posterior aspect of the iliac crest. And basically your glute runs laterally over your glute medius. So what you can have your patient do is have them knee flexion and then externally rotate, and you can feel that muscle group, or you can have them extend their hip. Yeah. Okay. And then lastly, we're going to palpate the ischial tuberosity and the bursa. So we're going to have our patient lying supine on their back, have them flex at the knee and the hip. And for this palpation, you're going to want to let your patient know where about you're going to be palpating. So I'm going to kind of be palpating deep in your butt. So as I come in, you just kind of want to come in with your thumbs and make sure you're not going lightly so that it's not like tickling them. And then you're going to want to press deep, and you can feel it. And the bursa is also going to be in the same spot, but like with the greater trochanteric bursa, you won't be able to really feel it unless it's inflamed.
Okay, ready?